sunshine. It's our sunshine.
I am Dr. Sampurna. I am ENT consultant in Sunshine Hospital. But today I am not going to talk about anything related to ENT. Today I am going to talk about the time we are going through the corona pandemic. Few months before also we thought maybe by the end of the June or July the corona cases will come down. Maybe the heat wave will reduce the coronavirus. Many hypotheses are there in the news channels, in the WhatsApp group, and also in the scientific communities. So the problem is we are not sure when exactly the number of cases and the pandemic situation will be over. The current situation is it may stay for a few months, it may stay for a year or so. So we have to adopt a completely new lifestyle, a completely new set of rules to keep us and our dear and near ones safe from this infection. First of all, I want to tell you that even though the lockdown situation is over by rule, but we have to limit our going outside and mixing with people just as we have done during the lockdown. So literally you need to suspect each and every one, your friend, your grocery shop owner, your delivery boy, it may be your maid, your cook, or anybody who comes in contact with you. You have to keep in your mind this person can be a possible carrier of the coronavirus. What does a carrier means? That the person may or may not be symptomatic. It's not necessary that a person must have fever or breathlessness to be corona positive. If the immunity is good, if the age is less, or for whatever reason, there are many people around who are actually positive for the virus if they were tested, but they have no symptoms. So what does it determine that who will have the symptom, who will go without symptom, or who will land up in ICU? That's a very complicated discussion beyond the scope of this video. But you must understand that you don't know in which category you fall. So if somebody is carrying the virus and you get infected, there are possibilities. Most possibly you may have just fever or diarrhea or loss of smell, loss of taste. You may land up with hypoxia, which means your blood oxygen level is coming down. If it is only fever, diarrhea, it can be manageable at home. If your oxygen level is falling down, you need hospital admission. There is possibility that you may not have any symptom, but you got positive, you came home and you made your children or your elderly parents positive. That is why you have to act as a responsible citizen, as a responsible father, mother, or friend, that I should not get infected myself and I should not carry the virus to infect anybody else. Another point I wanted to discuss today, that when you come to hospital, so there are some chronic diseases like say hypertension, diabetes, those things which need a doctor's follow-up regularly on a basis of 2 to 3 months or 6 months. For this, you need not come to hospital in person. You can do online consultation with your own consultant. If your known family physician or consultant is not available, you can consult any doctor in any corner of India like Practo, Mfine, Libret. Not only audio consultation, you can actually do video consultation also. You can send your previous prescription so that the doctor understands your situation. You can describe your problem. You can send pictures, everything, and get their opinion as to medicine to continue or not, what tests to be done. Even after doing those investigations, you can send them back the report. Why I'm telling this is because the situation is really, really serious. Every day in every hospital, not only in government places, but also in corporate, the corona patients number are increasing. This is a fact and a reality which we cannot deny. So unnecessary exposure of a healthy patient or an elderly patient just for the sake of consultation is not required. If it can be done online, please do online. If your doctor feels no, physical appearance and personal visit is required, your doctor will definitely tell you that. And coming back from marketplace or hospital or whatever it is, make sure first you wash your hand and foot. Your shoe, your sole of the shoe and your hand and foot can carry the virus easily. So first you wash it properly, and there are steps for the hand wash. So the first step is like this: the palm, and then the back of the finger, and then the waves of the finger, then the thumb, and then the tip of your finger, and the last step is the wrist. This is a proper hand wash which will take at least 30 seconds to do. And then clean your hand properly, also clean your foot, and change your dress after each outside visit. It may be the walking corridor of your gated community, but then also make sure after coming back you change your clothes and put the clothes into any simple detergent. Any detergent or soap can kill the virus. Do not keep that clothes back into your wardrobe to reuse again, because it's not done at this point of time. And last but not the least is good quality sleep and good nutrition is very, very important to maintain your immunity. And of course, mental health is becoming more and more important nowadays. So there is nothing else we can do but to accept the situation and act accordingly. So we have to be mentally and physically happy and healthy. So if you don't have a good sleep, your immunity is bound to come down. So do some kind of workout or walking or the household works, read good books. You can also have meditation or whatever spiritual way you like, but keep yourself happy and have a good 7 to 8 hours sleep at proper time. This will maintain your own immunity, and maintaining your own immunity will prevent you to get infected, or even if you're infected, your body may be fighting it back, so that you don't land up in a complication situation. Thank you.
Sunshine, it's our sunshine.